can guide us in taking the right action to address the events that are happening on the ground. So without further ado, I would like to welcome Doctors Alice Rothchild and Usaid Sir, who are joining us today. Dr. Alice is an author, filmmaker, and physician, and she focuses on human rights and social justice. Her most recent book, Finding Melody Sullivan, is a young adult novel exploring grief and friendship in the setting of broader political questions raised by realities in Israel-Palestine. She writes and lectures widely, authored books on health and human rights in the region, including Broken Promises, Broken Dreams, Stories of Jewish and Palestinian Trauma and Resilience, and Condition Critical, Life and Death in Israel-Palestine, contributed to a number of anthologies, the most recent being Reclaiming Judaism from Zionism, Stories of Personal Transformation, and What Jerusalem Means to Us, Jewish Reflections and Perspectives. She directed a documentary film, Voices Across the Divide, and she is a member of Jewish Voice for Peace and the mentor liaison for We Are Not Numbers, a program for young Gaza writers from whom we lost a group of talented, amazing young writers who lost their lives and got injured during this assault. Her middle grade novel, Old Enough to Know, will be published in December. She's completing a graphic novel focused on the Jerusalem Shafat refugee camp. I'm also honored to welcome a friend who I have never had the chance to actually connect with on a personal level properly, and it's unfortunate that we are connecting under these circumstances. Dr. Usaid Sir, who's a Palestinian academic physician from the Gaza Strip with interest in global health and surgery. Dr. Usaid, Dr. Alice, thanks for joining us today. Thanks for being with us. I believe we will start with a brief presentation that Dr. Alice has prepared that tackles the health situation on the ground. And then we will hear after that from Dr. Usaid, who is going to delve into the details of what challenges are facing doctors and physicians on the ground now. So again, Dr. Alice, please, the floor is yours.
Thank you. I'm going to share my screen. So first of all, I'm here in both sorrow and solidarity, and I want to share my comments recognizing the trauma that's going on for everyone in Gaza, everyone related to someone in Gaza, and also what I think we're seeing is the Gazification of the world response. And let me see if I can make this go forward. Oh, there we go. So I wanted to first just say that I've been to Gaza 4 times. The last time was in August. I go with NGOs, and I've always been invited by the Gaza Community Mental Health Program. So over the years, I've done direct services, women's empowerment, and lots of documentation. And I also work with several groups that are involved in Gaza. So I think if we're looking at the overall what's going on in healthcare, it's important to think about the ethical questions. And so that includes things like international law, collective punishment, what happens when a whole population has restrictions of access, what happens when a population is ghettoized, incarceration, mass incarceration, especially children, and proportionality in war. And it's important to remember that healthcare and healing occur in the socio-political context. So we need political solutions to health and human rights issues. And one way to just start thinking about it is, why is life expectancy in Israel 10 years more than in the West Bank and Gaza? So another thing we need to frame this, because I'm doing a lot of framing here, is the issue of Israeli apartheid and war crimes. Numerous human rights organizations have stated that Israel is practicing an apartheid regime and has committed war crimes in the past. And this is just a quote from B'Tselem, which is an Israeli human rights organization. And they stated, a regime that uses laws, practices, and organized violence to establish and maintain the supremacy of one group over another is an apartheid regime. We also see that there is medical apartheid in this region, and this really came to a clear forefront during the onset of the COVID epidemic. So with the creation of Oslo, the Palestinian Authority was established as responsible for healthcare in the occupied territories. But before that, there was the Geneva Accords, which stated that occupying powers have responsibility to combat infectious diseases. And what happened was that Israel wiped its hands of any responsibility for the COVID epidemic. And so Israel wanted Palestinians in the territories to have the responsibilities of sovereignty, which is providing healthcare, without the benefits of sovereignty, which is the resources and control over the system. So how you did during the pandemic totally depended on your geographic, ethnic, and political status. So I'm just going to read what I have on the left because it kind of sums it all up, and it's the sort of summary on medical apartheid. More than 70 years of Israeli domination and dispossession has affected Palestinian life through occupation, siege, annexation, de-development, and the permanent displacement of refugees. And this has all severely impacted the ability of Palestinians to access the essential building blocks of health. The fragmentation of society and destruction of the ability and opportunity to create essential institutions involved in healthcare has created a reality that is now recognized as medical apartheid. Two separate systems, two separate realities. We saw that in the disparities in life expectancy, and we see it in the disparities in infant mortality. 17.9 in the territories and 2.9 per thousand live births in Israel. And that was 2016, and it's gotten worse. So the way medical apartheid works is a de-development of the healthcare system, the lack of medical permits for higher level care, lack of medications and equipment secondary to blockade and occupation, direct attacks, which is what we're seeing, and high levels of conflict-related trauma. We also need to just be upfront about the impact of Zionism and medicine. In 2018, Israel passed the nation state bill, which officially privileged Jewish citizens in Israel over Palestinians. So there is institutional legalized racism in the country, which raises the issue of whether Jewish Israeli clinicians are able to see Palestinian citizens of Israel or Palestinians in the territories as fellow equal human beings. Now, I want to just go over the issue of what is the right to health, and this is as defined by Physicians for Human Rights Israel, and it involves freedom of movement and access to health services, and then all the things that go into making a healthy life, like clean water and sanitation, adequate nutrition, housing, adequate education, the ability to have employment, and to live in a nonviolent society. And the patient pamphlet on the right is from the Palestinian Medical Relief Society. So along with, breastfeed and take your calcium, they have a patient pamphlet about what to do if you're in labor at a checkpoint. Now, the other thing to remember is the Geneva Conventions, which basically state that occupying powers are not to interfere with the ability of civilian medical personnel to perform their humanitarian and medical functions. So as we see what's going on, we should have that framing in our minds. Now, if we look at healthcare in Gaza, the Lancet described it as fragmented and incoherent. We have about 2.3 million people, and healthcare is done by the Ministry of Health, which was established by post-Oslo. The United Nations Relief and Works Agency, or UNRWA, which is responsible for the care of refugees. There are about 1.5 million Gazan refugees in 8 crowded refugee camps. Then there are the non-governmental organizations, private providers, and then the role of the Israeli government in de-development. Now, before the assault, if we look at medical institutions, there were 13 government hospitals, there were primary healthcare centers, 50 from the Ministry of Health, 22 from UNRWA, and 70 from NGOs. There were approximately 40 private hospitals, 2 medical schools, and then a host of professional schools. But there's a real disconnect between the people that have the skills and the ability to let them work and get paid. So there were 120 nursing positions open each year in Gaza, and there are 5,000 nursing students in Gaza. There are less than 20 psychiatrists in Gaza, and less than 7 of them are physicians. Now, we know that before all the assault, the UN had said before 2020 that Gaza would not be habitable by 2020, and we are now 3 years beyond that. So before the assault started, we had a desperate humanitarian catastrophe, a siege, water that was polluted and salinated. 97% of the water is not drinkable. When I turned on the shower in the hotel I was staying in, salt water came out of the shower. And healthcare, nutrition, fuel, electricity, sewage, housing, all was on life support. There's been a tremendous amount of environmental contamination from all the military hardware, and the climate crisis is very present. Gaza is a coastal plain, and then the COVID-19 pandemic left its mark. Looking at other issues, the big health issues were the lack of electricity. Before the assault, electricity was erratic and not very often. There were fuel shortages, which caused the hospitals to close, a tremendous lack of specialists, exhausted medical personnel who were frequently unpaid, restrictions on permits to leave for higher level care, and medical and equipment shortages, and then on top of that, the pandemic. The other issues are the UNRWA funding for refugees. This was slashed by Trump. It was partially restored by Biden. And before the attack, the UNRWA was threatening to cease operations totally because of budget crises and donor fatigue. And this was in the face of deepening poverty, rising malnutrition, and rising unemployment. But the other thing is that the Israeli government has found other ways besides control to make life miserable for Gazans. They repeatedly fumigate farmland with herbicides along the eastern perimeter fence, which kill the crops and ruin the soil. They've decimated the fishing industry by severely limiting fishing zones and repeatedly attacking fishermen, destroying their boats, shooting at them, making them jump into the water. And they also do this thing where they have these wells right along the eastern fence, and they intentionally flood crops right before harvest time on the eastern fence. Now, there were other issues that I noted when I got there in August. There are around 18,000 Palestinians from Gaza who were working in Israel, mostly workers in agriculture and in construction, and they do not have any medical coverage. So when they get injured in these high risk jobs, they don't get provided health care, and they get dumped back in Gaza, where the treatment is usually not that available. The other issues that I saw for the first time were child beggars on the street, reports of men selling their kidneys to feed their families, and families not being able to afford olive oil. In August, the UN Right to Health program looked at the number of permits that the Israeli authorities allowed for Gazans, and it was 88% below the monthly average in 2000. And mostly it was these work-related permits for the day laborers. Only 6% of the exits permits were for patients that were referred for high-level treatment, and almost 20% of them were not approved on time. So you take the sickest people, you make them wait for a permit, and then you delay their permit and don't approve it. So these folks, get sicker and sometimes die. Now, when we try to imagine how to think about the current war, I think it's important to address the horrific tragedy, the fact that war crimes were committed by Hamas and now are being committed by Israel. My problem with how people talk about this is the framing, that very often people start in the middle and not from the beginning. So if we're going to talk about this, we need to talk about conditions, what happened in 48 and 67, what's going on with the refugees, the impact of the occupation and siege, the role of the current very right-wing fascist Israeli government, how Hamas developed and in response to what, and Israel's response to it, and the fact that there is now an ongoing genocide. And if we do not address the root causes of this issue, this will never get better. Now, when we look at what's going on, and these slides I put together on the 22nd, I've tried to update them a little bit. At that point, there were 4,600 people that had been killed, 2/3 women and children, with over 14,000 injured. This morning, it was reported that it was up to 5,700 people. It's reported that there were over 1,400 people missing under the rubble, including 800 children. Very few people are paying attention to what's going on in the West Bank, which is under total siege. And there's a lot of attacks from settlers and soldiers. So something like 91 people have been killed, including 27 children, 1,600 injured. In Israel, there are 1,400 who were killed and almost 5,000 who were injured. Of the 240 hostages in Gaza, 4 have been released. The Israeli airstrikes have been on multiple civilian gatherings, markets, houses of worship, bakeries, restaurants. There's a full electricity blackout, and the lack of fuel continues. And so what we're seeing is the disintegration of the healthcare system because the fuel is used to run electricity generators, which run the machines in the hospitals. Another issue is that almost half the housing units have been destroyed or damaged. There are 1.4 million internally displaced people, some sheltering in UNRWA-designated shelters, also in churches, on hospital facilities, in public buildings, and host families. There are severe shortages of water, food, and medicine. There's rationing of potable, drinkable water. The numbers I've seen are 1 to 3 liters per day. The minimum standard to survive is 20 liters. And this obviously increasing intercommunal tensions and gender-based violence. There are estimated to be 50,000 pregnant women with 5,500 deliveries each month, and those women are going to all be pregnant and deliver without adequate health care. Oops, sorry. Further issues are the patients, such as premature infants, the people on dialysis, the people in ICU, who are very, very dependent on having electricity. And we know that Israel has attacked healthcare people in institutions. There are reported 54 personnel killed, 90 injured, 35 health facilities have been damaged, including 19 hospitals. Ambulances have been destroyed, 10 hospitals and 29 health centers are now unable to function due to the strikes and lack of fuel. Hospitals are now setting up tents to accommodate the wounded. There have been 0 medical permits allowed to the West Bank or Israel for high-level care, and clinicians are reporting unusual burns on the dead and the wounded, raising the horrific issue that perhaps white phosphorus is being used again, which is illegal. This obviously affects mental health. It's affecting everyone's mental health. There were reports for children of developing convulsions secondary to severe anxiety, increased bedwetting, fear, aggressive behaviors, nervousness, and kids refusing to leave their parents' sides. On the 21st, the Rafah crossing to Egypt was finally opened. I think there are now about 54 trucks that have come through with food, water, and medical supplies. No fuel except WHO reported 34,000 liters of fuel for ambulances and 2 hospitals. There are reported 250 trucks waiting. The stocks of essential food commodities are down to 13 days, and that was 2 days ago. And so the risk of hunger and starvation is definitely there and happening, and the Israelis are not allowing any fishing for this fishing community. We should note that the hospitals in the north, which are the major hospitals in Gaza, have not evacuated as directed by Israel. They are failing, and they are facing this all with 150% capacity. The other concerns are groundwater. There is less than 5% of the pre-hostility levels of groundwater. Most of the sewage pumping stations are not operational, so they're talking about the risk of sewage flooding the streets. All 5 wastewater treatments are down, so raw sewage, once again, is being dumped into the sea. With all of these conditions, chickenpox, scabies, and diarrhea are increasing. Educational facilities were also bombed, 205, including 29 UNRWA schools, and 8 of these were used to shelter internally displaced people. UNRWA has also reported 29 of its staff have been killed, half were teachers. Tragically, 143 unidentified bodies have been buried in mass graves in Rafah and Gaza City. They're unidentified because whole 20 to 30 member families are killed all at once, and there's no one to identify who is who. At the same time, Palestinian armed groups are continuing their indiscriminate rocket fire into Israel. And while I was reviewing this morning and trying to update it, I got a WhatsApp message that in the past 15 minutes, there were 15, in the past 20 minutes, there were 15 bombing sorties. So the bombing is continuous and very aggressive. And then I got a message that UNRWA has announced they will have no fuel by the 25th. So this raises all the issues. Israel keeps saying we're trying not to hurt civilians, we're protecting civilians. This is not true when you look at the data. And people have started calling this a genocide, which is how it looks to me. And the whole issue of Israel committing war crimes is front and center. I just want to give you a particular look at the Gaza Community Mental Health Program, which was opened in 1990. It had 3 centers and 5 mobile clinics. This is their new building, which was built in 2019, very state-of-the-art building for mental health work. And they did training, direct care, community education, worked on reducing social stigma about mental health disease because it's very stigmatized on the Strip. And they have a telephone hotline. And their big interest was women, children, and prisoners, and treating chronic traumatic stress disorder. They were very careful to use evidence-based interventions. In my recent contacts with staff, there's been massive bombing throughout the area of this building. The roads are totally cratered, and all the windows in this building have been blown out. All their centers are closed. Their hotline is running. They have 5 staff that are staffing it. But since there's no minimal electricity, it's very hard to use your phones. Patients have all been sent their therapist phone numbers, but again, the inability to get your phones up and running is a problem. Also, they provided free medication, and now patients have to try to buy their own medication, which is hardly available and expensive. And the big problem is that the staff are as traumatized as the patients. They're rushing from bombs, they're sheltering, they're losing their homes and their families, and they're supposed to be taking care of people who are having mental health issues. So when we sort of step back and look at this whole picture, I think the big picture is one of structural racism, apartheid, cross-generational trauma, and now what appears to be a dramatic revenge. We see Israeli reliance on military solutions, and we see an utter disregard for the health and lives of Palestinian people who clearly matter less than their Jewish cohorts. And when Israel does something, a humanitarian gift, a bit of largesse, they are applauded, but they are actually responsible as the occupying power. We are also seeing a rise in digital and algorithmic surveillance, which we can also talk about, which also endangers Palestinians. And I think the crux of the problem is that the status quo can only continue if we as human beings see Jews as more human, more deserving, more innocent and honorable than Palestinian Arabs. If we as a community are blind to Arab suffering and history. So the fundamental issue is racism, which potentially leads to ethnic cleansing and genocide. And we can clearly see that the health of Palestinians is intrinsically linked to their liberation and to the end of the siege. And I'm just going to end with this picture this is a Banksy that I found once when I was in Gaza City. He'd written on a wall, "If we wash our hands of the conflict between the powerful and the powerless, we side with the powerful. We don't remain neutral." Thank you.